So you've just booked your first appointment to go see a pelvic floor physical therapist and you have no idea what to expect. You've probably been looking it up on YouTube or TikTok or Googling it, and you're finding all mixed reviews. Some people are saying it's awful. Some people are saying it's amazing. Some people are saying they put their finger in my butt. And you're like, what the heck is going on here? My name's Christine. I'm a pelvic floor physical therapist, and we're gonna break down what to expect during your first visit to a pelvic floor PT. We'll start off by saying this: everything is up to your comfort. I start by asking questions, and I think most physical therapists do. So we go through, why are you here? And what are you struggling with? After you give us a little bit of information and some of your background history, then we have our own prompted questions. I'll give you some of the examples of what I ask and how I ask them. So I always start off by going through gestational history. So if you're currently pregnant, have been pregnant before, and how many pregnancies? What was that like? Did you have any tearing? Did you give birth through vaginal delivery? Was it a cesarean? All that information, because that can lead me to looking at different things. We also discuss perimenopause, menopause, postmenopause as well, and figure out if you're currently breastfeeding or not. So that's how I first start off. So I also ask about bladder health, but I get deep. So I'm asking, how often are you peeing? Is it once an hour? Is it once every 10 minutes? Is it once every 5 hours? Do you wake up at night to pee? If you do, how many times? Do you feel like your bladder fully empties? And so many questions just about your bladder health. So knowing if you go pee just in case, if you hover over toilet seats, if you feel like once you pee, you can't hold it and you have to rush to the bathroom. If there are triggers like, every time I get home, I suddenly have to pee and I can't control myself. Surprise, surprise, that's not normal, even though it happens to a lot of people. That's called key in the door syndrome, and it's actually a sign of pelvic floor dysfunction. At this point, we also ask about leaking. So do you leak urine? Is it drops? Is it gushes? Do you have to wear pads because of it? When does it happen? Are there triggers for it? Do you feel it happening, or are you sitting there and suddenly your underwear is wet? So we get deep. Then we do the same exact thing with bowel movements. I want to know how often you're going, if you have to push or strain, what type of stool you have, do you have to wipe excessively after you go, everything. So be prepared to talk about your poop and talk about your pee. But we don't stop there. Then we talk about your menstruation. So if you are currently having a period, how often do you have it? How heavy is it? Do you use pads? Do you use tampons? How often do you need to change them? So many questions about details about your health, because it can all reveal some things. So there have been times where girls who are exercising a lot and are barely eating anything might come in and they're like, oh, I'm missing my period. And it's like, oh, we dig a little deeper. You're barely eating. You're over exercising. You might be overdoing it. We need to eat a little more. There could also be moments where I'm like, I can't diagnose this, but everything's pointing to endometriosis. You should probably talk to your doctor about these symptoms if you haven't already. So we ask these because, one, it helps us know if you're appropriate for physical therapy or not. Two, gives us a direction of what we should be looking at or what we need to do in your examination and your treatment. And three, if we need to refer you to someone because it might be something out of our scope of practice or more serious, we figure it out during these questions, or at least it gives us a hint of, look at this thing, or think about referring to someone else, or ask more questions, dig a little deeper. That's why we ask so many things. Then we talk about sexual function. If you have pain with intercourse, if you do, is it in certain positions? Is it in certain areas? Does it linger? Or is pain constant and it doesn't matter if you're having intercourse or not? Then we get into lifestyle. I want to know how your stress levels are, what you're eating, what you're drinking, how often you're exercising, how many hours of sleep are you getting, and everything in between. Because pelvic health is so much more than just the pelvic floor. It is so much more than just doing Kegels or deep belly breathing or whatever else you see on the internet. It is about our whole body, mind, soul connection. So when we're stressed, it can manifest into pelvic floor symptoms. And this happens often, which is why I ask about the lifestyle component, because we can't just treat one part of the human and expect everything else to align. It doesn't work that way. We're a whole person, so we have to be treated that way as well. And that's why you'll see that there are often times where I tell patients, hey, I want you to also see a mental health therapist, because I think it will help your pelvic floor symptoms a lot, and you will get more out of physical therapy if you're also treating and addressing the mental health component. Once we get all the questions out of the way, the most important question is, what do you want to get out of this? What would make you feel more confident, happier, that you can go out with your friends or have intercourse with the person you love and not be afraid? What are those goals? What does life look like on the other side of physical therapy? Because if you've done this, if you've come into pelvic floor physical therapy, it's super vulnerable. It takes time out of your day. And so clearly you're concerned about this and you want help. And so that's the most important part for me, is what does succeeding and what does living a life that you're comfortable with and happy with look like for you? And we work together to achieve that. Whether that means I want to dance at my grandson's wedding, or I want to run a marathon and not pee my pants, or I want to have intercourse with my husband and not be in pain. Whatever it is, your goal is mine. And so that's the most important part, is getting down to what really matters so that we can work together towards that. So after we do all the questioning and answers and all that, we get into the assessment part. And there's a few different parts to this. One, I look at how you move. So if there's a movement that you say, oh, I have issues with this particular thing, whether it's lifting my baby or squatting or running, we look at that to see how are you doing it, and is there any obvious thing that you're doing, like holding your breath or, squeezing too hard or whatever it is that might be contributing to your symptoms during that move. We look at your strength, we look at your mobility, and whatever else we need to look at. Then the part that you're probably not used to when it comes to physical therapy, we do the internal muscle assessment. This is always consensual, and you never have to do this if you don't want to. So what that means is you'll have your therapist and you in a private room with proper attire. So a gown, the bed is covered with a clean sheet. It's a private environment, and we do an internal muscle assessment. I would have gloves on, use one finger, a water-based lubricant, and go in through the vaginal opening and or the rectal opening to check your muscles. So when we do this, we look at a few things. We look at how's your sensation, how's your function. So are you able to squeeze? Are you able to relax? Do you have good coordination? Are there any muscles that are really, really tight or really, really weak and we need to address them? And that can lead us into the second part, which is our treatment. Whether that means we need to do some strengthening exercises, relaxation exercises, a mix of both, whether you need more internal treatment and that's something you can do by yourself at home or we can do in session. We'll figure that out together based on what makes the most sense for you. If you do not want to do the internal part, you never have to do it. And it's an ongoing consent process. So if you did it the first visit, but then the second visit, you're like, I don't want to do it. That actually kind of made me uncomfortable, or I don't feel like it today. You just let your therapist know. Even in the middle of a treatment, if you suddenly are like, I don't want to do this anymore, you tell your therapist and we will stop the treatment. It's always ongoing and it's always consensual. You're in charge, not us. Now, how long you're in physical therapy, it depends. Usually it takes 6 to 8 weeks to address strength and mobility deficits. That's how long it takes for us to build strength. But if we're dealing with something that is more chronic, so if you've had pain for 10 years, 6 weeks is just not enough. Honestly, it really depends on you, your therapist, and the time commitment you both come up with together. I've had patients who I see once a month. I've had some who I see once a week. I've had some who I see one time, give them the information, and they're like, you know what? I just wanted this to be a one-time visit. I'll do it on my own. And if I need to, I'll come back. So that really, really depends. If you have time restraints, communicate that. And we work together as a team to come up with a plan that makes sense for you and a timeline that makes sense for you. But remember, you cannot rush the healing process. So give your body enough time to heal and recover. And I hope that this has been helpful. If you have questions or concerns, let me know. And you can always ask your physical therapist. They'll be the best person to talk to about this. If you're interested in working with me, you can check out my website where you'll see more information on how to work with me, one-on-one coaching, or join the Pelvic Playground. Take care, and I will see you next time. Bye.